Good morning, everybody, and Happy New Year.
Yes.
Welcome to Manhattan DD Council.
281.
We'll get started in just a moment. Just admitting a couple of last minute people into the Zoom room. Welcome again. My name is Kathy Rocho Kelly, and I am privileged to chair this Manhattan DD Council. We're gonna start as we usually do with announcements. If you have an announcement to make, if you use the raise hand feature of Zoom, we will go around and call on people one by one. And we'll start with the virtual platform first. So any announcements, please raise your hand.
Mayo 16. Mayo 16.
I don't know. Hello?
Yes. go ahead.
Hi, this is Casey with AHRC. I just want to announce that we have availability, money's available in our family reimbursement program in Manhattan and also for free evals.
Thank you, Casey.
Thank you. I'll put the information in the chat.
Lindsay?
Hi, good morning. I'm Lindsay Stilson, Outreach and Marketing Specialist for Goodwill. We have openings in our Day Hab Without Walls and SEMP, Respite and Advanced Services located in East Harlem. I will be having an open house in East Harlem in February. So once I have that flyer, I will share it with the DD Council. But if you have any questions, you can call or email me and I'll put all my information in the chat.
Thanks, Lindsay. Okay.
Sorry, Kate Gottlieb, Adapt Community Network, Project Connect. We have our usual openings in our day programs, clinic, the IPSID clinic as well. We are doing evals for individuals, OTPT speech. And then also just wanted to announce for Wendy that there is a webinar on Tuesday, the 28th. It's called the Adele Friedman Housing Accessibility Fund. So this is a housing assistance services webinar, and I will put the information in the chat.
Thanks, Kate. Darlene?
Hi guys, this is Dylan Valenzuela, New York City Poison Center. Just want to highlight that we're having some free webinars on storing products safely next week. They're going to be in English, Spanish, and Mandarin. They're going to be on the 20. I'm over here getting my days mixed up. They're going to be, I believe, when is it? Oh, they're going to be on the 23rd and also on the 22nd. So today it's Wednesday and Thursday. I'm going to put the information in the chat as well. Okay.
Thank you. Thank you. Any other announcements in the virtual world? Alina?
Hi, good morning. Sorry, sorry. Seems like my voice is shot because of the weather. Good morning, guys. I'm the intake specialist for YAI, Young Adult Institute. We have openings in 2 out of our Manhattan Day programs, Madison for both site-based and without walls, and the Lenox Day Hab for site-based only. If anybody interested, I can share, I'll put down the information in the chat there, as well as my contact info. Thanks.
Thanks, Alina.
Good morning.
Signature page you can download.
Hi, good morning. My name is Angelica James. I'm from Unique Care Community Services. We currently have opening in our Day Hab in Brooklyn, Queens, Bronx, and Manhattan, as well as our in-home respite after school summer camp.
Hold on, stop talking for a second. Hold on, I need to mute myself.
Okay.
Any other announcements in the Zoom virtual? Then we'll move on to any announcements here at our in-person site at 83 Main Lane.
Hi, I'll announce. I'm Matthew with YAI. We do have openings in our family support programs, including independent living skills, Manhattan adult social skills, crisis intervention, in-home behavior management. And we also do have funds for family reimbursement. Feel free to email grouptraining@yai.org for more information. That's grouptraining@yai.org. Thank you.
Thanks, Matthew. Alana?
Hi, Alana Katz, from OHLB Cesar. We have money available for family reimbursements.
Thanks. Any other announcements? Going once, going twice. Thanks. We'll move on to New York City Department of Health and Mental Hygiene. Any updates, Rihanna?
Hi, good morning. No updates at this time from DOHMH. Thank you.
Thank you. I believe Sam is here for any OPWDD updates.
Good morning, everybody. Happy New Year. Maybe it's a little late in the year to say that, but Happy New Year to everybody. I don't have as many updates, but I can provide you what I certainly have. So give me one moment, please. Everybody can hear me, right? Just checking. Okay. Sorry. So the Governor Hochul's 2025 State of the State proposals that are related to our services. So we're going to be creating regional disability clinics. To expand access to competent and accessible healthcare for people with developmental disabilities and their families, Governor Hochul will provide funding to create regional disability clinics across the state. The funding will support one-time costs that increase accessibility and improve quality of care. So through these investments, people with developmental disabilities will be able to have access to more trusted and qualified providers for their medical needs. So the capital grants will be awarded by OPWDD in consultation with Department of Health and will be used specifically to increase access to medical care for people with intellectual and developmental disabilities. In addition, Governor Hochul will more than double the maximum tax credit from $2,100 to $5,000, and hopefully will simplify the process to increase the number of businesses successfully welcoming employees with disabilities. And this is to ensure and to strengthen the workers with disabilities employment tax credit. There's also processes in place to modernize the Institute for Basic Research, or as IBR, as some of you may know it. So to allow IBR to fulfill its important mission, Governor Hochul will invest $75 million to modernize IBR, which will include the establishment of genomics core facility to allow for customized identification of genetic defects underlying people's disabilities. In addition, the IBR renovation will include the transformation of former Willowbrook State School property into a center for learning. To recognize the historical significance that the former residents of Willowbrook and their family advocates had in sparking the state's disability rights movement, and certainly on influencing the developmental disabilities delivery system nationwide. And please bear in mind that this is the largest single financial commitment to IBR since it opened in 1968. In addition, there are sorry, let me just take a sip of tea. Sorry. So Governor Hochul will also increase wheelchair access for Medicaid members by increasing rates for clinical specialty evaluations for new wheelchairs, expanding coverage for repairs of previously owned power chairs, the motorized wheelchairs, expanding coverage of routine and preventive maintenance for wheelchairs, which will certainly help prevent costly breakdowns, minimize downtime for users, and extend the lifespan of this equipment. Also, the rates for residential and day services. OPWDD service providers were notified on December 23rd. That funding, I'm sorry, can you guys still hear me? I feel like there's a little bit of feedback. Can somebody confirm you guys can still hear me? Okay, good. I saw a couple of nods. Thank you for that.
Good.
Like I said, the OPWDD providers were notified on December 23rd that funding included in the fiscal year 2024 to 2025 budget to update reimbursement rates was approved for nonprofit residential and day service providers working with OPWDD or licensed by OPWDD, I should say. And retroactive to July 1st of 2024, these rates will ensure that OPWDD service providers are resourced to provide quality services and to offer more competitive wages, especially to those who are engaged in direct support. So in addition, there is an RFS that is out there for Home Enabling Supports, or HES. These Home Enabling Supports are available for people enrolled in the waiver, a subcomponent of the Assistive Technology program. So Home Enabling Supports assist the person to become more independent and less reliant on physically present support staff. And providers interested in becoming a Home Enabling Supports provider can submit a request for services application through January 20th, 2025. In addition, I'm sorry, I hear somebody speaking. Okay. So in addition, I think I mentioned at the last time that we met, I should say, that there is a podcast that OPWDD has launched called Accessing Life. Previously, there were 3 episodes. There are now 4 episodes available. So I will make sure to include the link for the YouTube channel where you can, if you so wish, watch the podcast. The next episode will be released in February, and it will cover the impact supported decision-making can have on a person's life. Another update is Georgetown University's National Center for Cultural Competence is currently preparing to conduct a second set of provider forums to be held January 21st and January 22nd. For all providers. These forums are designed to assess the self-described capacity of voluntary providers to provide all persons with intellectual and developmental disabilities and their families across racial, ethnic, linguistic, cultural, and in the communities and geographic areas in which they live.
Yes.
I'm sorry, I still hear somebody speaking.
She has weakness in one leg. That's
oh, thank you. So if anybody would like to attend, I'll put the link in the chat. So normally who we encourage to attend would be the CEO or their designee from provider agencies who has authority to respond on behalf of the organization and is knowledgeable on the organization's policies and practices. I'll put that in the chat. So Georgetown University has also launched a process to help providers engage in organizational self-assessment, as well as receiving technical assistance. The assessment Georgetown University will be using is called the Cultural and Linguistic Competence Assessment for Disability Organizations. GU is working with providers, self-advocates, and OPWDD state operations to implement the self-assessment process and plans to hopefully launch the tool sometime in February of this year. Let's see. OPWDD continues to offer opportunities for stakeholder engagement through surveys, town halls, and focus groups to inform the evaluation, the Guidehouse evaluation, sorry. The survey.
Thank you.
Sorry, the survey closed on January 10th and the town hall engagements will conclude on January 29th. This is for the self-direction program evaluation. And as some of you may or may not know, we do have an ADM that came out recently regarding the revamping of, it's not a complete revamping, but a more streamlined process for the CRO, Certified Residential Opportunities process. So the ADM was recently released and it clearly outlines the roles and responsibilities of OPWDD staff, the residential provider agencies, and care managers, and specifically indicates how care managers have to fully explore the least restrictive housing that might be right for each person. OPWDD will then determine if the person requesting housing needs the support of a certified home. So opportunities for certified housing are made available first for those in the greatest need. The person requesting certified housing and their family or representative must be supported to make informed decisions and have their personal and cultural needs reflected in their person-centered planning. OPWDD assigns a priority level for each person based on things like the care person needs because of their developmental disability, the availability of support from their family and friends, and the risk of harm in their current home. So it's a multi-stage rollout. The first of which I believe will start sometime in the spring. As I know more definitive timelines, I'll certainly share with you. We did recently have a training for providers on the new ADM just this past Friday. You know, I'll keep you posted of any additional guidance that is issued related to this ADM. And then finally, there is some availability of, oh, sorry, I'm so sorry, I just got a message. I'm ignoring it, don't worry, you guys are still the priority. Let me just look up something, sorry. I believe, I mean, I could kind of go through like a year-end issue, but sorry, but I don't want to ramble on too long. So I think I've provided a bit of information. Let me know if you guys have any questions and I'll endeavor to answer them.
Thanks, Sam. Before we get to any questions, if people could just make sure that if they are not speaking, that they are muted. So that way we can hear everybody and all the important information. Any questions for Sam or OPWDD updates? Ellie?
Sam, the same question. When can we get it in writing? Just keep asking.
Sorry, the updates you're talking about?
Yeah, you're reading, so you know, why can't we have them too?
I mean, the guidance that I've received is that this is an internal document, so internal document stays inside, but I will certainly I will certainly elevate that, okay?
That's
Don't worry, Ali, I got this. Thank you.
Thank you.
No problem.
Thanks, Sam.
No problem.
Any other questions, follow up for Sam? And on that note, for IAC updates, nobody from IAC was able to attend. However, Winnie did send a written update that I will have included in the minutes. But just to highlight a few of those, I know Sam hit pretty much all of the OPWDD updates that Winnie had included. I'm not sure of a couple, so desk reviews will be conducted for self-direction service recipients where FIs have approved community class utilization volume resulting in billing of over 24,000. As Sam mentioned, the self-direction survey closed earlier this month. There is an upcoming webinar on fatal five and the medications that affect them, and that's going to be on January 30th. And I'm pretty much sure that Sam hit all of the other OPWDD items. On education front, MDEs should now be using Atlas to schedule evaluations and uploading evals into the system. And information was sent out on January 3rd via email, including a one-pager with instructions. On DOH news, early intervention, last year's state budget's 5% increase for early intervention will finally be including rates, but retroactive to October 1st, 2024, rather than April 1st, 2024. There will also be a 20% decrease in EI telehealth reimbursement. Advocates will collaborate to determine the impact of this reduction. Also, there has been recent coverage by Newsday on the inadequate funding of EI, and the reporter plans to do another piece on issues surrounding the EI Hub. On the advocacy front, the State of the State address was held on January 14th. And as you hopefully know, the state budget, the governor will be releasing her state budget today at 1 o'clock. NIDA has held a series of virtual roundtables held with legislators across the state to discuss the OPWDD budget requests that were developed by NIDA. The legislators asked good questions, gave some good advice, and did not think that any of our asks were out of the question. Again, the ask include a 7.8% rate increase, the establishment of wage commission to study the adequacy of frontline staff salaries, and make recommendations for a plan to raise wages to sustain them in the system. Lobby days, the IAC and NIDA lobby days will be held on February 11th and 12th in Albany for all budget areas, including OPWDD, SED, and DOH. IAC members should have been receiving registration information that went out, I believe, last week. On IAC news, IAC said farewell to both Richard Bosch and Chris Trieber. And they look to be hiring 2 new staff members, a vice president for children's services, actually, which has been hired, that's going to be Kate Hoy, and a vice president for adult services. So we should be getting an announcement on that in the near future. An update on the Whole Person Supports Coalition. This is a statewide initiative involving all stakeholders to transform our system of services and supports. And the advisory and steering groups have been formed and have started to meet. And then finally, there is a DSP sustainability project, and IAC is working with Dr. Jan Cohen, who authorized a survey on the lives of DSPs, and they'll be working on building up a series of trainings and workshops to help agencies and providers to become a more supportive workplace. And that is all of IAC news. Any questions on IAC that I may be able to answer? Then we are actually very privileged today to have a guest presentation. There has been a recent addition to IDD supports and services, the IDD Ombuds Program, which will be overseen by Community Service Society. And we have Rachel Schuman here today to give us an overview and a presentation on that new program. Rachel?
Yes, Kathy, thanks so much. I do have slides. I'm not sure if I have the ability to share my screen. Yeah, I think you would have to make me like a co-host or something.
Got it.
Oh, there we go. Okay. All right. Hopefully folks can see my screen.
Yep, looks good.
Okay. All right. Well, good morning, everyone. I hope you are all staying warm and as healthy as you can. My name is Rachel Schuman, and I am here to provide a brief presentation on the Intellectual and Developmental Disabilities Ombuds Program, or IDDO. So again, this is kind of a quick rundown of what I'll be talking about. I'll first kind of introduce myself, then I'll talk about what Community Service Society is, and then I'll talk about the Ombuds program, and then hopefully we'll have enough time for some feedback and questions from you all. So again, like I said, my name is Rachel Schuman. I am the Training and Outreach Manager here at IDDO. And I always like to share that I have two siblings who are on the autism spectrum. So, you know, when I'm doing this work, I'm not just approaching it as a professional, but also as a sibling myself. I grew up in Westchester County. My parents were heavily involved in, you know, a group called FICA, which don't ask me to recall what the acronym has been changed to, but some of you may know it. So you know, this program is very personally and professionally important to me, and I'm a social worker by background. So enough about me. What is Community Service Society? So Community Service Society is over 100 years old, leading nonprofit in New York State that promotes economic opportunities for New Yorkers. And CSS accomplishes this mission in three ways: through direct services, so directly assisting people, through advocacy, and through research. And in my experience, I feel that a lot of times those three things inform one another. So, you know, if you're working directly with people, you're more easily able to understand the nuances and what, you know, what the big kind of problems or systemic issues are. But, you know, you also need the ability to, or the opportunity to advocate. And also research can be really, you know, helpful in informing, you know, both direct services and advocacy. So what does CSS, or Community Service Society, specifically do? So CSS actually has a pretty wide net. You know, CSS, we assist people using and enrolling into health insurance, resolving medical debt, resolving, student issues related to student loans, accessing different healthcare and services. We do policy around affordable housing. So it's a pretty wide array of sort of issues that CSS addresses. But the main way that we provide direct assistance is through our helpline. So people can call and receive assistance or advice over the phone. And then we also have partnerships with over 50 community-based organizations throughout the state of New York. So what is IDDO? Here is our beautiful logo. So we're an ombuds program or an ombudsman. So many people may not be familiar with the term, so I like to just define it before I kind of go into explain what IDDO is. So ombudsman actually comes from the Swedish word representative. And there can be all types of different ombudsmans or ombuds programs. One that I think a lot of people are familiar with are nursing home ombudsmans. So these are volunteers that go into nursing homes and work with nursing home residents to advocate, and resolve issues and, make sure that people are educated on their rights. And so those, even though we're not a nursing home ombudsman, a lot of those same principles apply to us. We're here to advocate for people. We're here to educate and try to be sort of a liaison between, the public and OPWDD. So the Ombuds program was actually put into law in 2023 under the mental hygiene law. And basically, the law states that OPWDD has to fund an entity to provide independent, conflict-free ombudsman services to assist individuals with disabilities and preserve their rights. So again, as I've already said, our mission is to act as a resource for people and advocate for individuals and families as they navigate OPWDD programs and services. So how did IDDO start? So obviously this law was passed, right? And it stated that OPWDD had to fund a separate entity or a separate organization to start this ombudsman program. So OPWDD put out a request for proposals and Community Service Society, among many other organizations, applied. And fortunately, CSS, was awarded the funding to build this program. And CSS actually has, pretty extensive experience running ombudsman programs. So there are 4 programs listed on the slide here: Community Health Advocates, or CHA, the Independent Consumer Advocacy Network, which you may have heard of. ICANN, they are also the ombudsman for Partners Health Plan, which is a dual insurance product for people with Medicare and Medicaid and OPWDD waiver. CSS also has the Managed Care Consumer Assistance Program, or MCAP, as well as Community Health Health Access to Addiction and Mental Health Care Project, or CHAMP, which is a behavioral health ombudsman. So what exactly do we do? So like all the other CSS programs, our main service is providing, is our helpline, where people can call and ask questions about OPWDD services and supports. We're also providing, casework. So for example, if someone might simply have a question about, eligibility or documentation needed for eligibility, or they might be, having difficulty getting an evaluation, or they might, not realize, they might have had their eligibility application denied because they, have autism and didn't provide, that specialty autism evaluation. So whatever the kind of issue is, that maybe might require further follow-up or further assistance or, or things like that. That's what we call casework, where, the person is assigned an advocate in our office to follow up with them and help them try to troubleshoot and resolve their issue. We also are doing education and outreach. So our outreach right now is really focused on letting people know that IDDO is here and we're here to help people. But hopefully we can kind of also start doing more substantive education workshops and things like that. But, has been really great to, meet many of you out at the DD councils and other, and other parent and caregiver and self-advocate groups. So that's been a lot of fun. And then our third, function is, trying to inform policy. So, we are collecting data on, the types of issues that we're seeing, and that data is going to be presented to OPWDD. And kind of identifying those issues is what we call a sentinel function. So what are the primary issues that are impacting individuals as they're navigating OPWDD services and supports? Now, I know many, if not all of you in this room, have, a lot of firsthand knowledge of what the issues are. But sometimes, we don't necessarily have the hard data to back up what we know. So, having the ability to really have numbers behind what we may already know are issues can be really useful and important for this community. So how exactly do we work? So we don't work necessarily alone. While we are the main kind of service provider and we run the helpline, and we're sort of we like to kind of call ourselves a hub and spokes model, where CSS is the hub, and then we have different spokes that make the wheel turn, so to speak, if we're speaking a little bit in a metaphor. So we are working with parent and caregiver groups. We have a technical specialist, and we're working with self-advocates as well as organizations across the state of New York who are operating as our regional outreach network. So like I mentioned, CSS is the hub. We have the spokes. So the, main partners that we've been engaging with are New York Lawyers for the Public Interest. They are a nonprofit that provides legal assistance to individuals. And for our organization, they're providing us with some training and technical assistance and legal referrals as needed. Our regional outreach network is made up of community-based organizations across the 5 DDRO regions. So we, my job has been building our outreach network and engaging with these new partners, which has been really exciting. Happy to share more if that's of interest. But yeah, that's and most important, how can someone request help from IDDO? So we do have a helpline. That helpline number is 1-800-762-9290. We also have an email address, iddo@cssny.org. We also have a online intake form. So if you really don't like speaking on the phone and you want to request assistance, the intake form is a really great way to do that, because it gives us the essential information that we need, and then we can go from there. We are working on getting our flyers translated into the 12 commonly spoken languages in New York State. And we do have 2 staff members on the helpline that speak Spanish, one who speaks Mandarin and Cantonese, and we have a language interpretation service for any other languages that that folks speak. And so we want to try to be able to serve and as many people in New York State as we can. So what are some of the examples of requests or assistance that we're providing to folks? So one of the things that can be a barrier is simply just getting the waiver eligibility, process started, or getting waiver eligibility. So, we've been educating people on eligibility and the front door process, as well as supporting them and the CCOs in getting the necessary assessments and documents together. We've also had a lot of inquiries around housing. So obviously we are mainly operating, in the supports and services under OPWDD, but we've also provided some education and resources on non-certified housing options and trying to troubleshoot issues that come up with housing. Obviously housing is a huge problem that we can't solve overnight, but trying to kind of mitigate some of the issues that people are experiencing. Answering questions about the role of CCOs and care managers and trying to improve communication. You know, we, you know, we understand that, the system, isn't, is far from perfect. And, that sometimes people are upset because, their care manager phrased something in a certain way or didn't get back to them as soon as they would like, or, or there might be, they might have really legitimate concerns that, we feel, should be escalated to, higher management at the CCOs. And we want to help people kind of navigate some of those issues while also, partnering with the CCOs and understanding that, they have a huge task of, working with individuals and families. Helping people navigate self-direction. Community classes are, a big, I guess, hot topic that we've gotten a lot of inquiries about. Self-direction in general, so helping people navigate that. And then, advising people on fair hearing and due process rights and providing legal referrals to legal services as necessary. Sorry, I'm losing my voice a little bit with all this cold weather. Services that IDDO does not provide. So, like I said, we understand the important role that CCOs play. We're not here to replace CCOs or operate or provide care management that CCOs are supposed to provide. So that's number one. Number two is we don't do any special education work. There are plenty of organizations that do this work already. And we are, it's not within the scope, under New York state law for the ombudsman, for IDDO to assist people with things like IEPs or Section 504 plans or other school-based services. We also don't assist with people with accessing early intervention services like ABA. However, I will say that, because CSS has a lot of other programs and experience and partnerships with organizations across the state, we're really well positioned to connect people to the correct resources, and in some cases do kind of a warm handoff to one of our sister programs. So for example, if someone is getting, is someone trying to get ABA therapy covered through their Medicaid managed care plan and they get a denial, IDDO, it's not within IDDO scope to assist with something like that, but our sister program CHAMP, which is the Behavioral Health Ombudsman, does assist with those kinds of issues. So we're able to kind of, do that warm handoff and not force the person to have to make another phone call or do another inquiry. So that's kind of something nice that we can, we can offer folks when they do have an issue that falls under, that doesn't fall under IDDO, but could fall under one of our other programs. Another example is, Medicaid applications. We currently have, a navigator. We have a navigator network as well as a facilitated enroller contract. So for people who are either have disabilities or above the age of 65, we do have a program that assists with Medicaid applications as well. The navigator network primarily works with those who are under 65 and don't have disabilities and are, trying to get insurance through the New York State marketplace. So again, a lot of different programs, happy to share more information if that's of interest. Okay, and now I mean, Kathy, you let me know what your, timing is, if there's time for questions or for feedback.
Absolutely, and thank you, Rachel. Any questions for Rachel? If you can, I know there was one comment in the chat. Will you be sharing this PowerPoint presentation with us?
Definitely, yes. I can share the PowerPoint.
Okay, if you can just email that to me, I will have that posted on our website.
Perfect. Thank you so much.
Thanks, Rachel. Margaret, you had a question? Margaret, I believe you're muted.
Sorry. You hear me now?
Yep, you're good.
Okay, sorry. So Rachel, I was wondering whether you're able to, your IDDO program is able to help people who are having disputes with their own agency. For instance, if there's a parent feeling that there's a neglect issue or that hasn't been addressed through the normal channels within the agency, are you able to mediate in those cases?
Yeah, so I want to be kind of careful because I guess I should probably add this to the presentation. Like, if there are issues that have either been brought to the Justice Center or need to be brought to the Justice Center, that's kind of outside of our scope. Obviously, we can advise people like, hey, this seems like potentially something you'll want to report. I don't know if that's what you meant, Margaret, or if you meant something else.
Well, I meant kind of recurring issues that are not being addressed, that maybe don't rise to the level of Justice Center, or maybe they do, but in the meantime, there's a live issue that needs to be addressed.
Yeah, I would say contact our helpline if this is a, OPWDD provider.
Mhm.
I think we're happy to see what we can do. Like I said, if it's like something that is, a abuse or neglect kind of report, we can't really get too involved in those, but other sort of quality of care issues, we could try to, try to work with the person. Does that answer your question?
Yes, I understand you that if the Justice Center is involved, then you cannot be. Is that what you're basically?
Yeah, that's
Okay.
yeah,
Okay, all right, got it. Thank you very much.
sure.
Musa, you have a question?
Hi, thank you for that presentation. That's really, really interesting. I have two questions. One is about the supervision of IDDO, and the other is how much case management you can actually offer. And then I actually have a third one as well. But so I'm just interested. So IDDO is funded by OPWDD, correct? And so
Yes, that's correct.
What are your deliverables that you're held up to deliver?
Great question. I love this is this is why I love the disability advocacy world, because you guys have like great questions. So I mean, we're not there's not a certain number of like individuals that we're required to help. Like, they're not like, oh, you need to help 100 people or 200 people. The data that they're really looking at is, how many people are you assisting? What areas of the state are you are you reaching? What kinds of issues are individuals having? Are you primarily talking to the, OPWDD participant or applicant themselves? Are you talking to a representative? And we sort of we kind of, the way that we kind of categorize things in our Salesforce database is we have something called needs and services. So need is kind of like, what is the person reaching out to us? What do they need? What sort of issue are they having? And there's kind of different categories that we have. So it's like access to care, or like quality of care, or cost of care, or like whatever the case may be. So we're categorizing kind of issues that way. And then we're reporting on like, what did we do to help that person? So sometimes it's just a matter of like, we provided information and educated the person on what they needed to know. Or sometimes it's like, oh, we actually had to contact their care manager and, have a conversation between the three of us. So we're capturing that data in our database and logging, all of our different contacts with people. And when we're sharing data, that data is anonymized, of course. We're not sharing like people's, personal health information. We take confidentiality very seriously. If we are reaching out to a third party, we typically need to get, a consent form signed and, make sure if we're not getting the consent form from the individual, that the person is either their legal guardian or, healthcare proxy. Probably more information than you wanted to know, but that's kind of our operations. And then in terms of our, capacity, right now we're a team of about, I want to say 8 people. We're about to hire one more help, counselor that answers the helpline. So, I think right now we've been able to manage the calls and emails that have been coming in, you know, relatively well. We're getting back to people, I think within 3 business days at the latest. So hopefully we can kind of keep that responsiveness up because that's very important to us. We have a pretty good like live answer rate. So when people are calling us, we're able to pick up the phone. Again, something we're hoping we can continue. And I think we're a new program, right? So we're still kind of in our, even though we're kind of our operations are set up and we're ready to help people, we're also still learning like, what
What do people want? So you're kind of
exactly, yeah.
sort of like a sensor operation on the state, and then you're going to see what level of resolution you can achieve. But you're basically bridging confusion to some kind of agency that can actually resolve the problem. Is that a fair?
Yeah, I think that's a fair assessment.
Okay, and then which is great. So I mean, you don't know yet how much case management time you can give each person. Like if
Yeah, I
they
mean, we're not care
multiple
managers, so that there's CCOs and care managers are there to provide ongoing case care management to people. We can help people like our sort of job is like sort of issue specific. So they're having a particular issue, we work with them to resolve it, and then if something else pops up, contact us. We're not going to turn people away, but the idea is we're kind of going by issue and not like meeting with the person regularly if they don't have a presenting issue or need going on. Does that
my final thing, and then I'm going to stop, is we're basically struggling with no information on the need for housing. There is no organized way of collecting housing need. The counties no longer take in that information, and Albany doesn't receive it. So my plea to you is to please really focus on how many people need housing, especially I'm finding high needs individuals who are not going to be easy to staff in a group way. So please make that a very, very particular focus, because that information is not going back. And to the extent you're data collecting, please ask everyone, do you need housing? Ask that, because nobody wants to hear that the demand and the need is very, very high. So I'm done.
Yeah,
Thank you.
no, it's already an issue we're hearing about pretty constantly. We don't have to really pry. People are telling us. But yeah, I think in terms of our data capturing, we could be, we're also still like learning how to best capture data. So like, we might say like, oh, these many people that call us don't have housing and they need housing. But, of course that alone doesn't really tell you, super specific information. So, we'll also, have to work out with OPWDD how much information, we can publish or share publicly. So that's another question that, I've gotten as I've been doing this presentation is like, are we going to be publishing our data? I think we want to be, as transparent as possible, but we also, since OPWDD is our funder, we do have to kind of work out with them what, what's going to work for them as well. So
Thank you, Rachel. There's a question in the chat about whether social workers or case managers can get access your information and resources directly, or do they need to actually refer families to you?
Yeah, I mean, I think, I think it's definitely okay to share, for social workers and care managers to have our information. I think the tricky thing with like referrals is sometimes like the care manager might not have all of the information that we need to kind of proceed on a, to actually assist with an issue. And so, I think they can, I think, they can do kind of that initial referral, but we would prioritize speaking with either, a representative or the individual themselves to really get, a full sense of what's happening. So, for referrals, I would say, the email, the IDDO@CSSNY is the best way to refer, just because that kind of automatically creates kind of a ticket in our system, like, hey, we need to follow up with this. Whereas if you email me, I try to be as responsive in my inbox as possible, but I could, miss something, and I want to make sure that if people are requesting assistance, they, that gets addressed right away. So the IDDO@CSSNY.org email is the best way to refer folks. If you have a organization that you think would benefit from this presentation, then you can reach out to me or my colleague, Flor Ramirez, who is the supervising attorney at IDDO.
Thanks, Rachel. Any other questions for Rachel?
How is the word getting out to, I mean, you want to speak to other agencies, but in general, like, is this something that all agencies must tell everybody about? Is it just a nice idea? Like, how is it actually coming into play? Because we know about it, but there's millions of people that we service, and I feel like there's not, how is the word getting out to everyone?
Yes.
Yeah, I mean, the commissioner did put out an email announcing IDDO, and that reached I think a good amount of folks. And then I think we're really relying on that regional outreach network to get the word out. People aren't required to refer people to us, but it is part, people have, we want to inform individuals who, are in the waiver about their rights. And one of those rights is to, contact the ombudsman for concerns or questions that they have about their services. But yeah, I mean, this is kind of what my job has been, is trying to get the word out. So I'm presenting at, I think, almost all of the DD councils. I still have to schedule a couple of them in New York City, as well as, engaging with partners in, region 2 and region 3 and region 5. So it's definitely a work in progress getting the word out. So if you think that someone could benefit from this service, I'm also happy to include our flyer when I send the presentation to Kathy, that you can feel free to circulate.
Yeah, that would be
And
great.
also, in addition, I know that you will be presenting the multiple family support service advisory councils on February 6th, I believe. So we'll
Yes.
have.
Yes,
have
that is correct.
February 6th is correct.
Yeah, so we'll have that information on our website for registration as well.
I want to ask, how's got the right to deny an apartment to mentally disabled person?
Kathy, were there any other questions?
What's that?
I want to ask, housing got the right to deny an apartment to mentally disabled person?
For me? I didn't hear your question.
I want to know if housing got the right to deny an apartment to a mentally disabled person.
Housing rights.
Mhm.
For disabled.
Mhm.
Because right now housing, they don't want to rent to mentally safe. That to parent, they got mentally safe.
Who does?
Housing, I want to make sure.
Oh, they have help.
Let me give you a piece.
Okay.
We already got you a customer.
Sorry.
Thanks so much. Yeah, we can talk separately offline if they have a specific question. It sounds like potentially about housing.
And we will definitely have them follow up with you, Joanne.
Perfect. Perfect. If there are no more questions, I actually have to hop off to another meeting. But thank you all so much. Like I said, it's not going to be the last that you'll be hearing from me. And I will try to attend, as many DD council meetings so that if questions do come up in the future, that I'm here to try to answer them. So thank you all so much.
Thank you so much, Rachel. We'll then move on to committee reports. Transition committee, Andrew?
Hi, good morning, everyone. I just want to give a plug for our next Manhattan Transition Committee meeting. This is going to be our annual Manhattan Adult Services meet and greet event. We are going to have 20 different organizations that provide services for adults with intellectual and developmental disabilities, focusing on that period coming out of high school into adult services. So we'll have information about day-hab programs, employment services, community classes. We'll have some CCOs represented. It should be a really good one-stop shop if you're looking to learn about what's available for life after high school for that group. I put a link and info in the chat along with a flyer. I'll recirculate that, but no RSVP needed for that. It's just a regular Zoom link. And what that's going to look like is a series of brief presentations. So a little snapshot of what each organization offers, and you'll have the opportunity to connect with them after the event. And sorry, the most important thing, that's going to be February 12th, Wednesday, February 12th, 10 a.m. to noon.
Thanks, Andrew. Manhattan Family Support Service Advisory Council, Jackie, or?
Is Mary still in the room? I
She
can't
is?
tell.
Yes. Hi, I'm Mary Weaver. I am a co-chair with Jackie Goldberg on the Manhattan Family Support Service Advisory Council. We're going to be at the Include NYC Fair on February 1st from 10 to, I think it's like 10 to 3. We also, Jackie and I spearheaded this multi-borough FSS Zoom meeting where Rachel will present on the Ombuds program. So it's going to be Manhattan, Queens, Bronx, Brooklyn, and Staten Island. If you want to join our meeting and hear more about them, you can sign up for our email on manhattanfamilyadvisory@gmail.com. We can put that in the chat. So that meeting is on February 6th at 10 o'clock. Again, open to all boroughs. Jackie and I thought that would be a great idea. Our 2 meetings after that are also going to be on guardianship on March 26th, which is a Wednesday at 10 o'clock. HRC's attorney and FSS contract, Stephanie Barron, will go over the guardianship program. And on the following April 9th, which is also a Wednesday, she's going to go over the actual petition page by page. Because you can actually do it yourself, or you can sign up on that FSS program to be on the waiting list to apply for guardianship. Again, our email is manhattanfamilyadvisory@gmail.com. Jackie, do you have anything?
No, you covered it all. Thank you.
Thanks, Brian. Thanks, Jackie.
I have a question. This is your meeting is for the 5 boroughs, but if we push it out to people further out, you're not going to reject anybody from coming on, right?
No, in fact, we did. I went to our statewide FSS
Yeah.
And I shared the link with our statewide reps and said that if they wanted anyone from New York State to join in on that link, that they'd be more than welcome to join us. Again, like Rachel said and Alana just here said, we want to get out the word that OPWDD has this program for advocacy and help for our community.
Yeah, good, great.
So please share.
Yeah, I will. Just make sure you open up the audience number.
Yeah, okay. No, it's.
Okay, and then don't believe Louisa or Wendy are here for Family Provider Information Committee. But they will be scheduling a meeting in sometime in February. So we will have that information posted on our website once we have the details for that. And then final announcement is, I know the governor is expected to have her budget released today. There's a press conference at 1 o'clock to release that budget. IAC will also be holding 2 budget briefings for the DD councils. One will be on February 7th, Friday, February 7th at 10 a.m. as well as February 14th at noon. We will have those links posted on our website and send out the specific information via email for that. That's it on the updates and announcements. Any other additional questions, comments? Then fingers crossed that we have a nice budget reveal in a couple of hours. Again, please stay tuned for advocacy efforts. We will be needing you and your voices to advocate on behalf of people with IDD. Also, almost forgot, we have a save the date for the 5-borough legislative event. It's going to be virtual again this year, and it will be on Thursday, March 6th. And we'll have registration information out very shortly. So stay tuned for that and look forward to seeing everybody there virtually. Our next full council meeting will be on February 18th. Again, it will be a hybrid meeting, and we will be once again in person here at AHRC and 83 Maiden Lane. Hopefully it'll be a little warmer, but everybody stay warm and stay well. Thank you.